Today we're diving into the fascinating world of emotional regulation and mental well-being. Think of it as your brain's toolkit for staying balanced, happy, and resilient. First off, let's talk about psychoeducation. Imagine it as giving your brain a user's manual, learning about how emotions work, what triggers them, and how your brain and body team up to create feelings. It's the foundation for all sorts of evidence-based interventions that help us navigate life's emotional roller coaster. Sometimes our emotions get a bit out of control. Think of mood swings, anxiety, or even depression. That's where emotional regulation comes into play. It's about recognizing your feelings, understanding their roots, and using strategies to manage them effectively. Techniques like mindfulness, deep breathing, or behavioral activation can help downregulate negative emotions and upregulate positive ones. For example, slow breathing exercise or physical relaxation can calm an overactive amygdala, the tiny brain region often involved in fear and aggression. Speaking of brain regions, our emotional responses are wired in a complex circuitry involving the amygdala, hippocampus, thalamus, and the orbitofrontal cortex. Think of these as the brain's emotional command center and memory hub. When these areas are in sync, what we call physiological synchronization, it's easier to stay calm and make better decisions. But when this circuitry is disrupted, as in mood disorders or conduct problems, emotions can become dysregulated, leading to aggressive behaviors, risky choices, or internalizing problems like anxiety and depression. To help with that, psychoeducation about brain function and emotional recognition is key. Recognizing facial expressions and emotional cues helps develop social skills and empathy, which are crucial for personal relationships and social support. For example, training in facial emotion perception can foster a positive bias, seeing the good in others rather than jumping to negative conclusions. When maladaptive reactions take over, like emotional lability or avoidance, cognitive flexibility and reappraisal become lifesavers. These are fancy terms for challenging negative assumptions, restructuring faulty attributions, and reinterpreting situations in a more balanced way. It's like giving your brain a fresh perspective, reducing the impact of cognitive biases that fuel anxiety, depression, or conduct disorders. In therapy, we often use cognitive bias modification, acceptance, and commitment therapy. These approaches encourage self-exploration, thinking about your thoughts and feelings without judgment, and cultivating acceptance. Sometimes pharmacotherapy medications complements psychosocial interventions, especially in anxiety, depression, or bipolar disorder. So whether it's managing stress, preventing maladaptive reactions, or improving emotional literacy, you focus on developing skills like self-monitoring, activity monitoring, and creating coping plans. In summary, mastering emotional regulation involves understanding your brain's emotional circuitry, practicing mindfulness, challenging negative assumptions, and developing flexible thinking. So go ahead and take a deep breath, smile, and give yourself the gift of emotional resilience.